Hello and welcome back to another episode of our skin education series with myself, where I talk about all kinds of skin issues that are commonly experienced essentially. And for the last 5 weeks we have been talking about acne, and my phone is wobbling just a tad. That should be much better now. And for the last 5 weeks we have been talking about acne and really delving into the individual topics within this realm. So for this last episode of the acne series, we're going to be covering hormones, which is a very inclusive topic that I honestly don't have the qualifications to really delve into it enough. And hello, thank you for the likes. It's so nice to see you all there. Hello, Emma. I really don't have those qualifications. I'm not an endocrinologist, but I do have to have a working understanding, and I'd love to impart onto you the knowledge that I know, just so you can understand a little bit better how skin and hormones, well, specifically acne and hormones, actually all happens. Because hello Kai, thank you for watching. We hear it all the time. Everyone says, oh, it's just hormonal, or it's hormonal acne, but do we really actually understand exactly what is happening? So I wanted to discuss that a little bit further today. And as always, if you are watching, say hello, because not all the names come up, and I'd love to say hello to you. And throughout the video, you're welcome to ask questions. I really do encourage that, and I'll be happy to answer them for you. And at the end, we'll do a bit more of a question and A if there's a few questions, and that's it. We're just going to dive straight in. So, acne and hormones. Is all acne caused by hormones? Now, essentially you could kind of say yes, but not really as well. So we do know acne, like the precursor to acne is essentially blocked pores. So when the pores, I might actually show you on the diagram here. So essentially we have pores all over our face, and that's where oil comes from, like sebum, and that's also where hairs come out from. And when these get plugged up and clogged, this is one of the precursors to acne. So to kind of just rewind just a tad, hormones can be a cause of this, and I'm going to talk to you about why this is the case, but not always as well. Pores can be blocked for a multitude of reasons, which we'll probably discuss a little bit more in general, but I'd love to show you in more detail kind of the structure of your skin. So essentially, I was talking about those pores. You can see here, this is where the hair comes out. We also call it the hair follicle. And out of this little pore here, this is where the oil comes out, and you can see just off to the side we have the sebum oil gland, and this is where sebocytes actually create oil. Now, the thing that you really need to know is essentially the sebocytes that live in here, so they're just cells that produce oil, they're actually stimulate, this production of oil is stimulated by hormones in the body, and it also, the amount of oil is also dependent on the size of the sebum gland as well. So we all know that we all have different varying amounts of oil that we produce. Some people are more oily and some people are more dry, and just for clarity's sake, we're all on the spectrum. So on one end of the spectrum we have dry skin, or we call lipid dry, so it's lacking in oil, and on the other end of the spectrum we have oily, and you'll be somewhere along this spectrum. Most people that I see are probably around a 5, some are more around the 2, and some, really rarely, to be quite honest, are somewhere up on the 8. So those are the people with larger sebum sebum glands essentially, and they genetically already produce a lot of oil. So you sit somewhere on the spectrum essentially, and the amount of sebum that you produce can create all different kinds of effects on the skin. So I want to rewind just a tad. So what we know now is that the sebum oil gland is where oil comes from, and it's then produced, it kind of secretes out and out through the pore, the hair follicle, onto the skin. And this the oil that's being produced is actually stimulated by hormones in the body, and we all have a varying amount genetically. All right, so with that understanding, this is kind of how, this is one of the, it's really important to know, because this area in here can actually become blocked, and this is what I said before, it's a precursor to acne, is a blocked follicle. So essentially what happens is something, perhaps we're having an abundance of oil happening in here, or perhaps we're having a lacking, a few other things are lacking within the cells, possibly like the enzymes aren't working to the best ability. So many reasons, like dehydration in the skin, so many reasons can cause a blocked pore. But essentially, one of the biggest precursors to a blocked pore is an abundance of oil. So essentially, this sebum oil gland, it just is producing so much that it just blocks up here. And there's also the quality of the oil being produced as well, which is honestly for another topic. So you understand now the production of oil in the skin, and you understand that it's produced, the amount that you're producing is caused by your genetics and your hormones. Now, how do your hormones even change this amount of oil that's being produced in the body? So androgens are the biggest cause. So basically androgens are male hormones, and now this is why you'll see when generally males will have an oilier type skin, they'll have larger pores. The reason why the pores are larger is because more oil is flowing out, so the pores naturally have to stretch and become widened. So males tend to have more oil in the skin, and this is due to more androgens, so male hormones found in the body, and they are DHT, testosterone, and DHEAS. I always have trouble with that one. So those three male androgens are also found in females as well. So we all have to have these hormones running through our body. They play vital roles essentially in the body. And for women, we have very low levels of testosterone in the body, but sometimes due to many reasons which we will discuss, these androgens can actually be hyped up in the body. And so these hyped up amount of androgens, what they are doing, they're essentially stimulating an excess of oil. So these little androgens kind of flow through the bloodstream. Well, first of all, they're triggered by the pituitary gland to produce hormones. So hormones are essentially just messengers. They're just telling your body what to do. So these androgens are created, they're flowing through your blood, and then essentially they come to the sebocyte, which I mentioned before, which is the oil producing cell, and it tells that sebocyte, hey, how you going there? We've just produced a whole heap of androgens in the body. We want you to kick up the pace, produce more oil. So this little sebocyte goes, all right, and starts to produce more oil. And so an abundance of oil was created. It starts to fill up this sebum gland, and if it is too much for what's going on with the skin, there becomes a blockage, and then this blockage then creates inflammation, and this inflammation, you get this blocking of the pore here, and then because there's a blockage caused in there, we then have a overgrowth of the wrong bacteria, which you would all might have heard of before, P. acne. So this blockage of oil essentially is a perfect breeding ground for P. acne to essentially kind of have a party. It's like they're just kind of get together and they create more of that bacteria. And what happens then is the body goes, oh no, there is an infection. They send white blood cells to the area, and white blood cells start to get to the area, start to fix everything up. But the way that you see white blood cells on your skin is actually pus. So that's what that white pussy, sorry for the graphics there, but that's actually white blood cells, and they're there because they detected an invader. And then essentially it pops. You create inflammation, you create an indentation in the skin, which then leads to acne scarring. Not always, but generally it'll leave a mark on the skin. So I hope that's all kind of making sense. Definitely give me some love hearts or some likes if you are understanding it. Otherwise, definitely leave a comment below. So it's really, really simple. And like I said, males do tend to have more, well, they do, they're biologically wired to have more testosterone in the body. That's why males are able to, they have bigger muscles, they're stronger, they have deeper voices. Whereas women, we're more petite and small, and we have breasts, and we're female, we're very different. So it's normal to have these balances, but they can become imbalanced due to many things. So let's talk about the causes of increased androgens in the body. Now, there are 4 main causes, and the first one is your age. So as we age, you all know about teenagers. This is usually the onset of acne, and this is because during puberty there's an onset of male androgens flowing around in the body. So this is generally where you will see an increase in, acne develop in the first stage, because these androgens really aren't present in the body as a child. There is actually a little spike that happens during a neonatal stage where the baby is really small, but then after that the androgens are pretty balanced. And this is why all children are essentially they're essentially very similar in body shape, right? And we don't tend to change until puberty, and it's because the androgens have kicked in. So in a male, the androgens come in and we build muscles, they get broad shoulders, they start to produce facial hair, and they tend to sweat and have a lot of sebum going on. Whereas females, we do have this these androgens start to kick in, but we go the other way where we have estrogen. So we develop breasts and we get our periods and all of that. So you can see, and hello Crystal, so you can see hormones play a huge role in the body. And hormones aren't, these are your sex hormones I'm talking about, but we have all kinds of hormones in the body. So you've probably heard of before cortisol, which is the stress hormone, and that also plays a role in acne, because this stress hormone, first of all, it starts to create more of a sensitive skin. Your skin kind of reacts a little bit more sensitively, and there's more inflammation when there's cortisol in the body. But cortisol also tells the sebocytes to produce more oil. So basically, this production of oil is a precursor to acne, but it's not always the cause. So they do say, now I don't know if there's conclusive evidence for this, because as you know, not all teenage boys will get acne, and not all females with higher amounts of androgens will experience acne. And they do have a theory for this. I'm not really sure if it's been confirmed or not. I suppose, does it really matter? But either way, they say that some people are more sensitive to androgens in the body, so their sebocytes are more sensitive. So when those androgens are present, their sebocytes are just more, the receptors are more sensitive to produce oil, whereas for some others, they're not as vulnerable. So that is a particular theory, why I should say, some people will have acne and some won't, even when they do have these increased androgens. And back to kind of the causes, because I did go a little bit off-road there. So there's 4 main causes of androgens, right? So I just mentioned age. So I just spoke about little babies. There is an increase in androgens. And then in teenage years, we have an increase in androgens, and then it does tend to kind of level out during adulthood, and things start to, you know, be all right. But then during the, you know, your 20s, this is when things start to change in your body. And for females in particular, this is when the onset of particular hormonal issues and things like endometriosis and PCOS tend to start to flare up in the body. So they're diseases of the female reproductive organs where it affects, essentially affects the ovaries. So that is the first reason. And we kind of touched on the second reason is disease. So disease like PCOS and endometriosis. There's I don't remember how to say this one. It was hyperplasia, androgenic hyperplasia, but that's one of the causes there. We also have genetics. So some people do just genetically have more androgens. And if I read correctly, this is actually the first time I've read this. I have to bring it up because it's very interesting. So a person with an I'm going to read from the website now. This is acne.org, which is actually a fantastic reference for anybody suffering from acne, because they kind of break down the science and make it very understandable. So essentially, a person with an extra Y chromosome will produce more androgens, which is a male. A normal male possesses 2 sex chromosomes, an X and a Y. If a male has an X and 2 Ys, he will then produce more androgens. There you go. I had no idea about that. You might find that really interesting. I know I did. I'm going to have some Googling to do a bit later. And the fourth reason for having more androgens in the body, and in case you haven't guessed it already, it's by artificially creating more androgens. So that means by taking some sort of testosterone, steroid, which artificial steroids, which is in pills, or intramuscular injection, which essentially creates more testosterone in the body. Now, plenty of reasons why this might happen. The general reason is because males are wanting to increase body mass and weight, and sometimes there are certain medications that do create more testosterone in the body. So there you go, there's 4 main reasons. I don't think it's really necessary for us to touch on what DHT, testosterone, and DHEAS are. If you do want me to go more into detail, let me know and I'll jump back to that. But I don't feel like it's that necessary. All you need to know is that we have hormones that are stimulating extra oil in the body, in your skin, I should say. So another kind of reason why women in particular will have an increase in breakouts during, and it's usually generally just before your menstruation, is because during our menstrual cycle, it's not just about our period, which is just at the start. Hello, Van. So our menstrual cycle is basically hormones going up and down, fluctuating to create different processes going on in the body to essentially have a fertile egg and create a baby. So we go through this cycle, right? And right before our period happens, we actually have a little spike in testosterone due to the change in hormones. So this is why, for women, any of the women out there, this is why generally you'll start to break out just before your period. And it's because you're getting a surge of testosterone due to the other hormones in your body changing due to your menstruation cycle. So it's really, really normal to have these breakouts. You can't really do much about it, because remember, an excess of oil is a precursor to acne, only because this excess of oil creates blockages. But remember, these blockages can actually be created in your skin from other reasons as well, and we were talking before, enzymes not working properly, or the quality of the oil, so the viscosity of the oil essentially. And the really cool thing here is that these hormones are being stimulated in the body by for multiple reasons. So for example, with the disease that's going on, I can't personally change that. That's the job of an endocrinologist or a gynecologist if we're talking about a woman's reproductive health, and they can then prescribe things to change the environment within the body. However, what I can change is topically what's going on in the skin. So what I can do, if I know that there is a hormonal disease, let's say endometriosis going on in the body, if I know that that's present and we are getting an overproduction of oil. So what I can do is kind of cater to that condition. What I can do is administer topical ingredients that I know are going to help change the viscosity of the oil. It's actually going to help neutralize and minimize the amount of P. acne bacteria. It's also going to help unblock the follicle. So it's going the topical ingredients, hello Crystal, the topical ingredients that I'm administering to the skin are actually changing the environment on the skin. So although we have the hormones in the body being a major influence, so it's telling the skin produce more oil, I'm coming from this end and going, all right, let's fix what's going on topically. Now it probably sounds, and hello Jen, it probably sounds like what I'm doing is a little bit of a band-aid effect, but do really think about this. So essentially, yes, this extra oil is being produced and this is create an environment that's pro-acne. And what I'm doing is drip feeding the skin certain actives to kind of control and minimize the situation that's going on. And the cool thing is when you're treating topically with these active ingredients that I know are going to change this environment, it can actually kind of settle down the environment. And it doesn't mean that these products on the skin are going to be needed to be used for the rest of someone's life. The hormonal issues might still be going strong, but we've changed the environment, we've settled it down, we've lessened the amount of inflammation, and we've actually brought back the strength of the skin, making the skin less vulnerable to an acne environment, from essentially neutralizing an acneic environment. I hope that's making sense. So it's really, really amazing when you start to make the connections about how acne is actually caused and how much control we actually have. Now, one of the things that I know you're all dying to hear about is why when we come off the pill as a female, the oral contraceptive pill, we tend to have a breakout of acne. Everyone knows that this happens and everybody fears it because there's a lot of females these days that are kind of becoming a little bit more aware of our menstrual health and are realizing that we've been on these oral contraceptive pills for years, and perhaps we would like to look after our hormones in a more, not our hormones, but our fertility in a much more natural way. I know that I've done that personally and I've preferred going this route. Not everybody wants to go down this route, but that is my beliefs. Crystal says, you're making perfect sense. Thank you so much. So essentially, people are becoming more aware and they're really not wanting to have synthetic drugs in their system anymore, and that's totally okay. But what we're seeing, and what I'm seeing a lot in clinic, is these young women in their 20s who have been on the oral contraceptive pill since their teenage years. So essentially, while these androgens are kind of at their peak, and so they start taking the oral contraceptive pill, they probably decide to start coming off of it when they're about 25, 26 maybe, and then as soon as they come off, they have a surge of acne and they're going, what is going on? I'm an adult, why am I experiencing this? And the main reason for this is because in a lot of oral contraceptive pill, we have and I'll just quickly bring it up now so I don't butcher the name, I'm very bad at these chemical names, cyproterone acetate. So you'll find it in a lot of oral contraceptive pills, and essentially what that is an androgen receptor blocker. So it's actually telling your sebocytes, the androgens, to not create so much oil. Essentially, it's kind of limiting that amount that's being produced. I'm getting a bit mixed up with all the long words here. So essentially they've gone off the pill, and this pill has actually contained this ingredient, so cyproterone acetate, and then that means all of a sudden their body has to deal with, and more specifically their skin has to deal with, this surge of oil. And what happens is this extra oil causes the blockages, the blockage causes the bacteria overgrowth, the bacteria overgrowth causes inflammation and more blockage, and it's just a cascade. And then, you know, we do other things to add into the mix. So we see these breakouts happening on the skin, so we wash it really, really well. We strip back the skin, we start to exfoliate, so then we start to impair the barrier, and we mix up that natural microbiome even more, creating more acne bacteria. It's all just a big cascade. And we basically need to get this topical environment in order, so the body can start to, well, essentially the skin can start to normalize and create a good environment. Whew, that was a big long sentence. And this is why we're seeing this happen so often. Now, like I said, I'm not an expert in this field, and you know, these androgen receptor blockers, they might be, you know, they're being prescribed for particular reasons. So it's actually more of a female, they only really do this for females, because in males, if they were giving androgen receptor blockers, they would start to, you know, they would start to produce breasts and things like this. But in a female, you'll find them in the oral contraceptive pill, but some doctors are actually prescribing these in different pharmacological medications, and they're actually to calm down the androgens essentially in the body to treat the acne. I don't feel like that's completely, in my perspective, I don't feel like that's a wholesome treatment. It doesn't feel very holistic to me. I feel like all it really is doing, it's changing the hormones in the body, so then we don't have this excess of oil, when we could be coming at it from the complete other angle, and actually, you know, accepting that for some reason this body is producing more oil than another body, and that's okay. But what it's caused is an environment of acne, so we can do all these other things. I really don't feel that treating the hormones in that way is a very wholesome way to go about it. But this is why a lot of doctors will prescribe the oral contraceptive pill. And when I found that out, I was mind blown. It's, you know, to me, it doesn't seem, it's not the way I would want to treat it. I would want to treat essentially the cause. And although that might seem like the cause, it's really changing the way your whole body functions. Because remember, hormones are just messengers, and these messengers tell your body, your organs essentially, to behave differently. Whew, so we've got about 2 minutes left on the clock, guys. This has been a pretty intense episode. Emma Craft says progesterone cream helps to treat your crazy skin. Yeah, so I'm not exactly sure how the progesterone cream, is that because you have a higher levels of progesterone or lower levels of progesterone? I'm not exactly sure how that one works with the skin. It's not something it's come up a lot, but deep down I know it's more than that. Yeah, you're right, Emma. It is much more than that. I find that's more of a band-aid treatment, when, like I said, that oil on the skin is something that a lot of people actually deal with every single day. Like, we have people who genetically have an abundance of oil, and you know, we don't start treating them with androgen receptor blockers because they've got an abundance of oil. We treat the skin accordingly to what it is genetically predisposed to. So that's my philosophy, and that's essentially the reason. And Emma says, I love chocolate and milk, which are both going to be causes, some precursors to acne as well. So that's okay. You have to have those vices in your life. Don't feel bad about them. So essentially, just to kind of go back to that first point, this really proves why I'm able to make changes, and many other skin therapists and corneotherapists out there can make changes to acne, is because the things we're putting topically onto the skin are having such a profound effect on this topical environment. what I say to all of my clients, and I've probably repeated myself many times on these videos, but it's really important to know, is that your skin is its own environment, and you've got all the organs and organ systems, I should say, in your body doing, you know, their own ecosystem as well. So your skin is an ecosystem with its own bacteria, microbiome that's flourishing in its own way. It has its own functions and properties and unique things about it. We also have our gut, so our digestive system, which also has its own amount of bacteria. We also have our endocrine system, being our hormones. We have our lymphatic system, and essentially all these systems in the body are working cohesively all together. So they're all doing, you know, their job to essentially keep you alive, and they're all working together. But essentially, when one of them becomes imbalanced, so maybe the skin environment, skin ecosystem becomes imbalanced, we see a few things go wrong. But perhaps this skin ecosystem isn't so imbalanced, and then the hormonal system, the endocrine system, becomes imbalanced, and what that causes is a knock-on effect to all the other areas and systems of the body. So that's the way I like to think of it. So this is why we can really change this environment, this ecosystem up here, even while these other systems in the body are a little bit imbalanced. Whew, I think that's all we really need to say on this topic, and I'm hoping this has really empowered you. If you are watching and you thought to yourself, you know, my acne is just caused by hormones, I can't do anything about that, you absolutely can. And you know that I have proof for this, because I have been seeing a client since May, and she was diagnosed with PCOS. It was a part, you know, and she was told the reason why you're having acne is because of this PCOS, which is creating a high amount of testosterone in the body. So, you know, acne is just something you're going to have to deal with. But essentially, we've treated her acne. She doesn't get these large cystic nodules anymore. She gets the occasional breakout, and now we're starting to get a reduction in the acne scars as well. So someone with an internal issue, which is, you know, not really changing, it's a very difficult thing to treat. And there is things to treat it, absolutely, and it depends on every female out there. But essentially, she's still got this issue in her body, but we can still make a significant change. She doesn't have acne anymore. So I hope that's proof enough, and I hope this has empowered you and given you a complete new reset on hormones and skin. And I think it's time for us to all, you know, really consider that, you know, we don't want to just succumb, that's not the right word. We're not a victim to our bodies. We are actually in control of our bodies, and we can actually do so much to change what's going on in our bodies. We are in control, essentially, you know, and we can change the way our body essentially functions by diet and lifestyle. So Kai has just commented, from my understanding, progesterone topically is designed to block the cellular receptors of the skin to inhibit the formation of sebum. Right. Because progesterone is the precursor for estrogen and testosterone within the body to increase sebum production. Awesome. Thank you, Kai, for elaborating on that. It's, like I said, so essentially, progesterone topically blocks the cellular receptors of the skin to inhibit the formation of sebum. Yeah, so it's like an androgen receptor blocker, because progesterone is the precursor for estrogen and testosterone with the ability to increase sebum. Yeah. Cool. Thank you so much for popping that in there. I hope that helped you, Emma, to really understand exactly how progesterone cream works. I mean, they use progesterone cream for many other reasons. So I just haven't seen it to treat acne before. So essentially, if there's no questions, I'm going to end this broadcast here and just leave you on a positive note, and just realize that you are in complete control. Some things, you know, we are genetically predisposed to, and that's, you know, that's okay. These things are happening, and we can really change, you know, our diet, our lifestyle to, I guess, not compensate, but help these situations that are going on. So that is all I have to say. And if you are watching and you do have acne and you're thinking, I I don't know what to do. You know, I want to change this topical environment on my skin, but I really don't know what to do. That's essentially my job as a skin therapist and corneotherapist. And if you're in that position right now, you're in luck, because I'm still offering my free skin analysis and consults. They're 45-minute consults, and they're only going to be free till the end of September. So only less than a month left to actually come in and have me look at your skin essentially for free, in a really in-depth way where you get to find out so much about your skin. So only till the end of September. And on that bombshell, we're going to end the video. So take care, and I look forward to seeing you next week when I'm going to release a new mini series within our skin education series. If anyone has any ideas on what they'd like me to cover, please leave them below. But I do have a few little mini series ideas that you'll be able to see within the events section of the Soul Awaken Skin Therapies page very, very soon. Have a wonderful night, and I've enjoyed being here with you, and we'll talk soon. Bye.